Obese patients, who are about to undergo knee or hip replacement surgery, generally need to lose some weight. However, it is difficult for them to lose weight through exercise. Biomedical researchers at the University of Otago's Faculty of Dentistry have designed a novel intraoral device that restricts food intake, thereby triggering weight loss. As part of the undertaken study, the research team recruited 7 otherwise healthy but obese participants, and the intraoral device, which incorporated closed-field magnets with keepers to restrict mouth opening, was cemented to their first molars. The participants were given a commercially available liquid diet for a period of 2 weeks. The comfort and tolerability of the device were assessed with a survey during and after the study. Quite interestingly, the participants showed a mean weight loss of 6.36 kilograms during a period of 14 days. The only adverse effect was that the participants had trouble pronouncing certain words and felt tense or embarrassed occasionally. There was no reported change in taste perception. However, participants occasionally felt some discomfort and were slightly unhappy with the quality of life during those 14 days. However, in the end, qualitative analysis showed that the participants were happy with the outcome and were motivated to lose more weight. This finding holds promise for patients who are unable to exercise owing to certain biological limitations.